Ever wondered how a stroke, one of the most serious medical emergencies, can be managed? Today we delve into the fascinating world of catheter techniques, particularly the mechanical thrombectomy, and their role in stroke treatment. A stroke happens when blood flow to an area of the brain is cut off. This can occur due to a blocked blood vessel known as an ischemic stroke, or a ruptured blood vessel termed a hemorrhagic stroke. The disruption of blood supply deprives the brain cells of oxygen and nutrients, causing them to start dying within minutes. This can result in a myriad of symptoms, from weakness and numbness, to speech difficulties, and even loss of consciousness. Diagnosing a stroke involves a comprehensive clinical examination and imaging tests. One such test is the catheter cerebral angiography. In this procedure, a thin, flexible tube known as a catheter is inserted into a blood vessel in the groin or wrist. From there, it's carefully guided to the blood vessels in the brain. A contrast dye is then injected through the catheter, and X-ray images are taken to visualize the blood flow in the brain. But how exactly do catheter techniques factor into stroke management? When a blood clot is blocking a major blood vessel in the brain, catheter techniques such as mechanical thrombectomy come into play. This procedure involves using a catheter with a specialized device at its tip to remove the blood clot. By doing so, it restores blood flow to the brain and prevents further damage. Mechanical thrombectomy is typically recommended for eligible patients within the first 24 hours of symptom onset. Wrapping up, we've learned that stroke is a medical emergency that requires swift diagnosis and treatment. Catheter cerebral angiography is instrumental in evaluating stroke patients, and mechanical thrombectomy can potentially save lives. However, the most important thing to remember is that time is of the essence when dealing with a stroke. Any symptoms should prompt immediate medical attention, so don't hesitate to seek help at the nearest medical facility if you suspect a stroke. Thank you for tuning in to this educational video. We trust you've gained some valuable insights and increased your understanding of stroke management.